Hi, I'm Dr. Nerita, a men's health specialist with over 12 years of experience helping men over 60 restore their vitality, confidence, and connection. And today, I'm going to walk you through the 10 hidden risks of masturbation after 60, and more importantly, how to turn this private habit into a tool that actually protects your prostate, strengthens your testosterone, and enhances your intimacy safely and naturally. Before we begin, make sure to subscribe and turn on notifications because I release evidence-based videos like this every week made for men in their 60s, 70s, and beyond. And let me know in the comments, where are you watching from? I read every one of them myself. Now, let's talk about what no one warns you about. Most men believe masturbation is either good or bad, black or white. But the truth? It's neither. Self-pleasure can support your health, improving sleep, stress relief, and even testosterone balance. But if done the wrong way, it can also drain your energy, lower your sensitivity, and disconnect you from real intimacy. So today, let's walk through the 10 risks older men often overlook and how to fix each one step by step. Risk 1: social isolation. I once had a 67-year-old patient, a retired teacher. He told me, "Doc, I haven't touched another person in months, but I still take care of things on my own. Is that bad?" The truth is, there's nothing wrong with self-pleasure. The issue comes when it replaces real connection instead of supporting it. When masturbation becomes your only source of intimacy, it can slowly pull you away from the world, from friends, from laughter, from simple touch. You start to withdraw, not because you're old, but because you've stopped believing anyone still wants to connect. Touch is medicine. Physical connection keeps your emotional circuits alive, your hormones balanced, and your confidence intact. So if you've been feeling disconnected, start small. Call an old friend, join a group, say hello to someone new. Remember, intimacy isn't just physical, it's being seen, heard, and human again. Risk 2: skin microlesions. As we age, the skin, especially around the genitals, becomes thinner, drier, and slower to heal. Without proper care, friction can cause micro tears, tiny, invisible cuts that lead to irritation, inflammation, and even infections. If you've ever felt a sting, redness, or soreness afterward, that's your body saying, be gentler. Here's how to fix it. Use a water-based lubricant, not petroleum jelly or spit. Be gentle. You're not racing the clock anymore. This is about connection, not completion. Take your time. Pleasure at this age isn't less, it's deeper, wiser, and more fulfilling. Your body deserves care, not punishment. Risk 3: desensitization. One of the most common problems I see: men who say, "Doc, I can get there on my own, but not with my partner." That's not a hormone problem, that's neurological conditioning. When you masturbate the same way every time, same grip, same rhythm, same fantasy, your brain begins to associate pleasure with that exact pattern. It's like a path in the woods. Walk it every day, and your brain forgets how to explore anywhere else. Over time, you may struggle to feel aroused or satisfied without recreating that exact routine. The fix? Change your technique. Use your imagination, not just external stimulation. Slow down, give your body and brain variety. Your nervous system isn't broken, it's just overtrained. Give it time to reawaken. Risk 4: masking erectile dysfunction. Many men can perform solo but struggle with a partner. They think, well, it works when I'm alone, so it must be fine. But often, that's an early warning sign of circulatory or hormonal decline. Your erection is a mirror of your vascular health. If blood flow weakens, if your arteries stiffen, or your testosterone drops, you'll feel it first in your erections. Masturbation can sometimes bypass these issues because it requires less complexity. But that doesn't mean the problem isn't there. So if you notice weaker, shorter, or inconsistent erections, don't ignore it. Get checked. It's not weakness. It's wisdom catching small issues before they grow. Risk 5: nerve compression. Here's something few men realize. How you sit matters. If you masturbate while hunched or sitting on a hard surface, you can compress the pudendal nerve, the one responsible for genital sensation. Over time, this can cause numbness, tingling, or dull sensitivity. Use a soft surface. Try lying down or reclining. Take breaks from sitting during the day, let circulation flow. Comfort isn't laziness, it's protection. Risk 6. Emotional escape. For many men, masturbation becomes less about pleasure and more about escape from stress, boredom, or loneliness. It releases dopamine and oxytocin, giving short-term calm, but when it's your only way to regulate emotion, it can numb you to deeper feelings. You deserve more than momentary relief. Move your body. Talk to someone, a friend, counselor, or even your doctor. Build routines that bring meaning, not just distraction. Emotional strength doesn't mean you don't feel, it means you feel and still choose connection. Risk 7. Guilt or shame. Many men from older generations were taught that masturbation was sinful or dirty. That belief stays long after you've grown up. But here's the truth. There's nothing shameful about caring for your body. Chronic guilt increases stress hormones, weakens erections, and damages confidence. The cure isn't stopping, it's healing what you believe about yourself. Practice self-compassion. If guilt feels heavy, speak to a sex-positive therapist. Rewrite the story. You're not broken. You're human. Risk 8. Pelvic congestion. Overdoing it, even with good intentions, can backfire. Too frequent ejaculation, especially multiple times daily, can cause pelvic congestion, a dull ache, heaviness, or pressure. Your body needs recovery time to restore circulation and hormone balance. Give yourself 2-3 days between sessions. Pleasure grows when it's balanced, not constant. Risk 9. Semen quality decline. If you're still considering fatherhood, yes, even in your 60s or 70s, frequent ejaculation can reduce sperm concentration. It doesn't harm you, but it may affect fertility. For optimal sperm health, allow 2-5 days between ejaculations. Stay hydrated. Maintain zinc, vitamin D, and omega-3 intake. Your ability to create life isn't gone, it just requires balance. This one is crucial. Pornography, especially hyperstimulating or unrealistic content, trains your brain to crave fantasy over real touch. When real intimacy feels less exciting, it's not you, it's your dopamine system being overstimulated. You can reset it. Reduce porn exposure. Focus on sensory touch, breathing, eye contact, emotion. Rebuild connection with the real world. Your brain can recover. It's built to. You just have to give it time and intention. Let's make this practical. Gentle, mindful touch. Use lubrication. Go slow. Listen to your body. Vary your habits. Change rhythm, position, even the environment. Add movement. Walking, stretching, yoga, blood flow fuels arousal. Stay emotionally connected. Seek warmth, not just release. Check your health. See a doctor if you notice persistent weakness or numbness. And yes, you can still enjoy pleasure. Just do it with awareness, intention, and self-respect. If you're listening right now and thinking, maybe I've done some of these things wrong, please don't shame yourself. You've lived decades. You've carried families, fought battles, faced losses. You deserve peace, not punishment. Your body isn't against you, it's communicating with you. And when you listen with respect, it rewards you with vitality. You're still capable of passion, strength, and connection. Age doesn't take that from you, silence and shame do. So, here's my message to every man watching this. You're not too old, you're not past your prime. You are still capable of growth, strength, and deep connection if you give yourself permission to learn again. If this video helped you understand your body better, give it a thumbs up, subscribe, and share it with a friend who might need to hear it too.